Thanks for inviting us in. We want to start tonight with this frustrating problem. Millions of Americans still getting stuck with surprise medical bills every year. Odds are it's probably happened to you or someone you know. So tonight, 13 investigates the holdup with state and federal laws to stop it and what happens to you in the meantime. But first tonight, let's break down how this surprise billing actually works. Here's how it happens. You need an operation, so you pick a local hospital that is in your insurance network. You know in-network facilities and doctors will cost you less. So you also pick an in-network surgeon to perform the operation. But on the day of the surgery, turns out the anesthesiologist and radiologist in the operating room, they're both private contractors, out-of-network providers not covered by your insurance plan. So they'll cost more. As a result, that surprising final bill you get from the hospital is much higher than expected. It's called balance billing because you're responsible for paying the balance or the difference between the in-network and out-of-network rates. Indiana lawmakers took action more than 18 months ago, but 13 investigators discovered it is still happening. So why are Hoosiers still getting these surprise bills, and what can you do to avoid becoming a victim? Our Bob Siegel and Allison Gormley did some digging to find out.
This is a bill Elise Raw was not expecting.
$5,294.92.
It's from this hospital in Carmel, where Elise went for a routine colonoscopy back in May.
The hospital was in network.
Yes.
In-network hospital, routine procedure, insurance would cover it all.
In-network screening colonoscopies are covered at 100%. And so that's when I looked up the doctor, saw the doctor on their website, said, yep, I'm good.
But when the bill arrived, not good. According to Elise, her insurance company claims the colonoscopy at the in-network hospital involves some services that are out of network, so that $5,000 falls on her.
In my mind, it's so flagrantly dishonest.
Surprise bills like this were supposed to be a thing of the past. Early last year, Indiana lawmakers overwhelmingly approved a new law designed to drastically reduce surprise medical bills for unsuspecting patients like Elise.
That is exactly the type of person we are trying to help.
Ben Smaltz is the state representative who authored House Bill 1004. It requires doctors and hospitals to be much more transparent about what their services will cost.
Your health care is so important. It's only fair that the person knows what they're going to pay. What other business do we do in our everyday lives that we get the service done, have no idea what it's going to cost, and in the end are expected to pay whatever we're told?
Indiana's new law requires health providers to give a good faith estimate of charges to any patient who requests one before a medical procedure is performed. It also limits what out-of-network providers can charge you when you get services at an in-network facility, unless you're warned about the higher rates and agree to them ahead of time. The new state law was supposed to take effect this summer, but the Indiana General Assembly postponed many elements of the new law, so now it does not fully kick in until January 1st. If the law had been in effect, Elise would have seen ahead of time that some services would be billed as out-of-network, so she could have made a choice to go somewhere else.
Absolutely. There's no way I would have paid this kind of money for a procedure that I could have gotten in-network covered 100%.
We need an end to this. That's your typical surprise billing case.
Brian Tabor is president of the Indiana Hospital Association, and he says hospitals want to stop these types of surprise bills just as much as patients.
Is this giving a black eye to the hospital industry?
I think it has. Surprise bills rarely involve the hospital itself.
He says most of the surprises arise out of disputes between insurance companies and private doctors who work at hospitals. But because hospitals often mail the bills, they get pulled into the dispute, with patients getting stuck in the middle.
Patients should not be in the middle of those disputes. Surprise billing laws take the patient out of the middle, and as hospitals That's what we want to see.
On January 1st, a new federal law will also take effect. The No Surprises Act will ban surprise billing for both scheduled medical procedures and emergency care. And it will allow patients in all 50 states to get good faith estimates before receiving their health care. But in the meantime...
So what's going to happen with that bill?
I don't know.
Elise is stuck with unexpected charges that she's still appealing. Until the new laws take effect, experts say don't be surprised if your health care results in a surprise bill.
Until January 1st, I think we are not going to see really an end to that.
The good news, change is on the horizon. The bad news, this is still a massive problem. And despite new laws, well, medical billing is still very confusing. It's not very transparent, and that's why so many folks get caught off guard and become victims. 13 News consumer reporter Allison Gormley is joining us now to help us cut through all that confusion. Allison, help us understand, is there a way to help prevent these surprise medical bills in the first place?
Well, while a crystal ball would be pretty helpful, it comes down to asking the right questions even before you get the good faith estimate that Bob mentioned earlier. So let's break it down into 3 key questions. The first question, is my doctor in network? Because not all providers are necessarily hospital employees, according to patient advocate Caitlin Donovan.
Think of it as a contract position. They contract to work at the hospital, but the hospital usually in most states does not mandate that that provider has to also be under the same insurance umbrella.
Next question, will I see anyone else during my procedure who might not be in network?
Anesthesiologists, radiologists, people that you don't think of when you go to the hospital for a surgery, but they're there every single time.
And the third question, is the facility in network? While the doctor may be in network, where they perform the procedure might not be. But even if you do everything right, things still come up. So when it was Donovan's turn to head to the hospital, she got creative.
So we made a sign for our door that said, if you are not on our insurance, please do not come in. And it certainly evoked some chatter from the people who did come in the room, but I can tell you we didn't get any surprise bills.
Now, while that move may not be for everyone, it got her point across. Once you have your answers and decided on a facility or two, ask for a good faith estimate at least 5 days in advance. And ask about fees. One of them, a new patient fee. If you're going to a new doctor or you haven't seen your doctor in a few years, ask if they charge a new patient fee. Next, facility fees. Facility fees can happen when the doctor you're seeing doesn't own the practice. Think hospital-owned clinics. If you would love to have this checklist on your phone or fridge, I made one for you. Just head to the WTHR What's the Deal tab.
And those are good questions to keep handy. The new federal law that protects you against these surprise medical bills will take effect in about 2 months. And we've got more information about what your rights are under this No Surprises Act. Just go to WTHR.com/13investigates.